Smile, ladies.
Okay.
All right. Hi, everyone.
Hello.
Hello. Okay. We're going to do a little teaching about culturally competent care. I know we're all, three of us are from different cultures. You're from the white culture, she's from African culture, I'm from the African culture, even though there may be differences between our cultures, but
Definitely.
yeah. So, but I'm going to talk about Mexicans and healthcare. I got a little PowerPoint prepared. Okay. The number one thing when we think about Mexicans, we think of language. Most Mexicans speak Spanish, so at least the ones that come from Mexico. So we want to make sure we're on the same page when we're talking and assessing patients. Like if we ask questions and they give us wrong answers because they didn't understand the questions, that might mess up their treatments and everything else. So we want to have in place a system that would ensure that someone who speaks Spanish has a translator or an interpreter to translate the questions that we ask. Now we have to, sometimes we may not have an interpreter or translator present, and we may have to use family members, but that's not the best way because we're not sure if the the patient wants the family member to know what is going on with them, wants a family member to know what's going on with them. So we want to pick somebody that is from a professional interpreter or translator. And also body language, like I know I'm sitting too close to you. In my culture, that is considered okay. In your culture, it may be that I'm invading your privacy. And for Mexicans, they get very close to you. You think they're getting in your face, but they're just, that's how it works for them. See, like, if you kind of, when they come close and you kind of withdraw, the thing you're rejecting them, they may see that as a sign of unfriendliness or rejection. So if you want to assess a Mexican patient, talk to them, it's better to come to their level of comfort. If they want to be close to you, then it's okay to get close, as long as it doesn't impair your ability to take care of them. And we know eye contact is a big it's a big thing as far as communication is concerned. If I'm talking to you and I'm looking elsewhere, you're either thinking I'm not serious about, I'm not really talking to you, or I'm acting rude. But with Mexicans, it's rude to actually to sustain eye contact. Like if I was, because like for an older person talking to a younger person, like if you're my boss, you're talking to me, I'm supposed to be either looking down or looking somewhere else. If I maintain eye contact, it's considered rude.
Oh wow.
Yeah.
I tell everybody, sometimes you have a meeting or something like that. We used to have it in the cafeteria every month or something like that. I said, well, I'm sorry. Because I come from a culture which, if you're talking to somebody older than you, or somebody who's your boss, like you said, or something like that, by respect, sometimes we just look down. And I know here it's very important to do eye contact. I try, but sometimes I do like this, but it's not. And it's good to tell people because sometimes they said, "Oh, she doesn't care," or something.
Being rude or you're it's a big deal. And also your body language, your stance. Like if you were to stand with your hands on your hips, it's considered confrontational. You think you're either angry at them or something.
And if you see an African lady walking and do,
Mm-hmm.
say, ooh,
It's
okay.
about to get serious. And now, as far as time, like if you have an appointment set up for 10 o'clock, typical Mexican American is not going to show up at 10 o'clock. They may show up at 11 o'clock. To them, time is not very important. I know in the Western culture, time is very important. You're supposed to be at 10, you're supposed to be at 10. But with them, they kind of relax with time. And I think that applies to the African countries
Yeah.
as well. And they don't believe in, they're more present oriented. Like you say, okay, you have diabetes, so you have to do this, that, so you can live longer. No, they want to focus on the present. They're not going to deprive themselves of things that they like to eat because they think it's going to make them sick in the future. No, they rather just live for now. And they have this thing called fatality. What will be, will be. It's God's will. So if I'm sick and I'm going to die, it's God's will. I'm not going to go out of my way to deprive myself of things the doctor has ordered has ordered for me not to have. I'm just going to do what I think makes me happy, because what will be will be. And they have other health practices. They have traditional healers called curanderos. So it's not uncommon for them to go to a curandero before coming to the hospital or to go into the doctor's office, because it's kind of like it's holistic. They take this and they take that and they put it together, and they believe it's going to make them better. And you just have to understand that it's the culture to go to see a curandero. That's a typical curandero. And probably something else I failed to mention. They also believe in hot or cold. They have the hot or cold theory. Like they believe that like fever is hot. You have fever, you're hot, so you have to consume cold liquids, like cold teas or cold drinks. And if you have a cold illness, you have to eat cold food. Like cold illness is like diarrhea, so you have to eat hot food, cold. What am I saying? If you have a hot illness like fever, you drink iced tea and stuff. If you have a cold illness like diarrhea, you have to eat hot soup, hot food. And it goes in line with the holistic theory that the body is in harmony with nature. So hot and cold get together to make you healthy. So that's the little bit I put together.
All right, awesome.
And I hope this has enlightened you all about the culture and how it impacts healthcare.
Yeah, definitely. Yeah, it's I think it's very important because sometimes people don't understand. So I think you're supposed to be a foreigner to understand. Like you come in this country, you don't speak any word of English. The frustration. You see somebody talking, you think they're talking about you or something like that. And sometimes people think, oh, she's dumb, she doesn't know nothing. But it's not like that. You already have your language. Like in Cameroon, in French, we have French is the main language, but we have our native languages.
Right.
In Senegal, we have French, the main, but we have 7 different dialects.
Yeah. Wow.
So you go home, you speak your own. You go to government, whatever, something, you speak French. So you come here, you have to learn English, And sometimes it's not easy because I say, oh, how long you been here? And you still have an accent? I said, I was almost 40 years when I came here. There is no way the accent will go away.
No.
Because my son was 4 years when you come here, you speak like everybody else. So it's the age. After 13, 15 years, it's very hard to get the regular thing. Yeah, it's interesting.
Thank you.
It's an interesting
Thank you,
debate.
Miss Elizabeth.
Thank you for
You're welcome. And good luck for your presentation.
Thank you.